Sounding the alarm. She is concerned about the higher death rates in the African American and Hispanic communities due to COVID-19. And my co-anchor Todd Quinones is live from home tonight. And Todd, you spoke with Dr. Regina Benjamin about research that she's doing with the American Heart Association to figure out why this is.
Tricia, there certainly is strong evidence, as we know, to suggest that people with pre-existing chronic health conditions such as diabetes, high blood pressure, obesity, and cardiovascular disease are all at a higher risk of getting seriously sick or even dying. Now, Dr. Benjamin says that those are health issues that do plague minority communities, but she believes the problem may have less to do with race and more to do with a lack of education and also access to quality health care.
We also know that your zip code is a better predictor of your longevity and health outcomes than your genetic code. And so it's not just the fact that you're African American or that you're Hispanic. It also applies to people in rural communities.
Is it because people with these pre-existing conditions have a weaker immune system? Why are they succumbing at a higher rate?
And so we have put in a $2.5 million rapid response research fund so that we can get researchers to try to figure out why and what the COVID-19, how it affects to underlying cardiovascular disease.
So people with cardiovascular disease or other underlying health conditions, we know now that they appear to be at greater risk. What should they do? Does this mean they should take extra precautions above the norm that the rest of us are taking?
From the medical standpoint, we need to be more vigilant. We need to be looking at these populations when they come in the hospital or come to call our offices, that we know that they're at higher risk.
So you think this is clearly a warning shot to people that they gotta monitor, that we all have to do a better job of monitoring our health, but also trying to get healthier, because this virus looks like it's going to be around for a while, and who knows what's down the road.
And this virus and any other virus, these are conditions that we need to take care of. We need to eliminate those health disparities that exist in our society. And hopefully, as we come out of this, we'll have better policies and plans that we can do that.
So in the meantime, Dr. Benjamin says that people, especially with chronic health issues, really need to make sure that they are in fact practicing social distancing, wearing a mask in public, and that they are also eating healthy and getting some exercise. Tricia.
That's right, because exercising also helps boost your immune system. But the interesting thing that she said, which I think, Todd, is so true, that this has brought our health really to the forefront, this virus has.
Yeah, and all these disparities that we sort of knew were out there really have sort of come to light, and it's all about, according to Dr. Benjamin, really, she believes a lack of access to really quality health care. She says that's why we're seeing it in rural communities outside of Nevada and other states, similar kind of issues starting to sprout up.
Absolutely. Todd, thank you so much. All right, well, millions